Hi everyone, welcome to CAPSA. Today we will discuss about glaucoma. Okay, so what is glaucoma? In glaucoma, intraocular pressure actually increases. Normal intraocular pressure is 10 to 20 millimeter Hg. 10 to 20 millimeter of Hg. Okay, and in glaucoma, loss of vision occurs due to the damage of optic nerve. Okay. And so we need to be clear about how we will able to decrease the formation of aqueous humor and how we will able to improve the drainage system. Okay. Now the drainage system follows actually two type of pathway. One is trabecular and second one is uveoscleral. Okay. It means the aqueous humor flows through two type of pathways. First one is trabecular and second one is uveoscleral pathway. Okay. Now, what are the types of glaucoma? Glaucoma actually have two types. You can see here chronic or simple glaucoma and acute. In chronic glaucoma, also known as wide angle glaucoma. Okay, and acute congestive glaucoma, also known as narrow angle or closed angle glaucoma. This chronic or simple glaucoma, for this type of glaucoma, pharmacological treatment is preferred. But for acute congestive type of glaucoma, surgical management or laser iridotomy is preferred. Okay. Now we will see or understand through a diagram how the aqueous humor forms, from where aqueous humor forms and how they travel to the eye. Okay. So this is the lens part. This is suspensory ligament. This ciliary body. You can see here everything is markable. From the ciliary body, aqueous humor actually forms, and from the anterior chamber, it goes to the first pathway, trabecular pathway. That is the normal pathway. Okay? And another pathway, that is uveoscleral pathway. This pathway is uveoscleral pathway. So when there is a glaucoma, we need to improve the drainage system of glaucoma. Okay, glaucoma patient. So for this purpose, sometimes we need to follow another pathway, that is uveoscleral pathway. In the normal pathway, aqueous humor always follow the trabecular pathway, but if the trabecular pathway is blocked, we need to follow the uveoscleral pathway. Okay. So what is open angle glaucoma and closed angle or narrow angle glaucoma? This is iris and this is your cornea. The space, if the space is open and the aqueous humor is able to go through this trabecular pathway, that is known as open angle glaucoma. If the angle is closed and aqueous humor is not able to go through trabecular pathway, that is closed angle. Clear to you? Now we will understand what are the drugs used. So first agent that is used, osmotic agent, mannitol and glycerol. Percentage is here. Now how they act? They actually draw the fluid from the eye into the circulation by osmotic effect and reduces the intraocular pressure in case of acute congestive glaucoma. So these drugs are preferable for acute congestive glaucoma. Second classification is carbonic anhydrase enzyme inhibitor or CA enzyme inhibitor. Okay. First one is acetazolamide, dorzolamide, brinzolamide. Okay. So acetazolamide is given through the oral IV route. Dorzolamide actually given through the topical route. And mannitol, you need to remember that mannitol is given through IV infusion. Okay. Now, How this type of enzyme inhibitors act? They actually inhibit the carbonic anhydrase enzyme. As a result, decreases the bicarbonate formation in the ciliary epithelium, and thus they decreases the formation of aqueous. Now we need to be clear about these two type of topical carbonic anhydrase inhibitors are actually preferable for chronic simple glaucoma, but systemic acetazolamide preferred for acute congestive glaucoma. Okay. Now third classification is beta blocker. Which kind of beta blocker? These are actually non-selective and all are used topically. Okay, topically. Now how they actually act? They decreases the aqueous humor formation by blocking the beta 2 receptor which is present in the ciliary epithelium. Okay, so that is the mechanism of action of beta blocker. Now another classification, the fourth classification is PGF2-alpha analog or Prostaglandin F2-alpha analog. First one is Latanoprost, second one is Travoprost and Bimatoprost. Okay, among these, this drug is very much important. Now how they reduces the intraocular pressure? They actually reduces IOP or intraocular pressure probably by facilitating uveoscleral outflow, and they are the drug of choice for open angle glaucoma and acute angle glaucoma. So Latanoprost, Travoprost, Bimatoprost are the drug of choice for chronic as well as acute. Okay, and in the market a combination of drug is used, that is Latanoprost plus Timolol. This combination is preferable for the treatment of glaucoma. Now fifth classification is Muscarinic agonist. Okay, Muscarinic agonist are Pilocarpine, Ocusert and Physostic. I have used the term Ocusert, so you need to be clear about what is Ocusert. So Ocusert actually kept beneath the lower eyelid in glaucoma patients. Okay, and it releases the drug slowly for a week following a single application. That is known as Ocusert. Okay. Now you need to be clear about 5% of pilocarpine used for chronic simple glaucoma and near about 2% of pilocarpine used for acute congestive glaucoma. Okay. Now the sixth classification is, that is alpha-adrenergic agonist. Okay. Which type of receptor? Actually it acts to alpha 2 type of receptor. You need to remember that alpha 2 receptor. Okay. Now among these two, apraclonidine and brimonidine, actually act through alpha 2 act as alpha 2 agonist, and they reduces the formation of aqueous humor and thus decreases intraocular pressure. But interesting fact is B.Pharm, that is a prodrug of adrenaline, and it obviously need to penetrate the cornea, and with the help of esterases they gets converted to adrenaline, and thus they increases the uveoscleral outflow and trabecular outflow. Okay, so this is the prodrug. The question always comes from what kind of prodrug used in the glaucoma treatment, that is B.Pharm. Okay, so this is the end of my lecture. If you like my video, please do like, comment, share and subscribe. Thank you.